Hello and welcome again to Latina Voices Smart Talk. I'm Minerva Perez with my co-hostesses Sofia Droguet and Patricia Gras.
And we are a talk show about universal topics with a Latina perspective.
The mantra is clear, and today we're discussing healthcare. What do we know? The system is broken. Over 2.2 trillion spent. 47 million without healthcare. 1 out of 7 Americans. The healthcare costs keep escalating. They escalate at a higher rate than inflation and wages. What are we to do?
With the issue weighing heavily on all Americans' shoulders, today we're trying to get the 101 on this topic. That's just ahead, but right now, ladies, it's time for talk. Let's talk.
Let's talk about the economy, because that's on everyone's
Everybody's
mind.
talking.
Frankly, I've been angry for months about this, and I'd have to say that I went back and I remember just growing up with the S&L crisis, and that we bailed out the S&Ls,
in the 90s,
the savings and loans, thrift institutions for $200 billion. And we're doing exactly the same thing, and in a way, it was because they were not regulated, because they borrowed more than they could handle, and because people want to get more than they can afford.
That's true.
And this has got to stop.
Some of this blame goes on the American public.
Absolutely.
On the citizens of the United States who live beyond their means. I mean, everybody's talking about that as well. But we also have to hold accountable the people who did this. And I think it started with greed.
Yeah, it's all about greed, I mean, unfortunately, and it's lack of regulation and oversight.
Well, interesting. I don't know about the lack of regulation. There was a very important convention of Harvard specialists on the subject that just transpired, and they spoke of many of these banks that are at fault had a lot of regulation, regulated by all the entities. Some of them are foreign, and they had foreign regulation as well. But somehow that still didn't suffice. So is it regulation, lack thereof? What's going to happen? And some are saying, is it going to be the next Great Depression?
Yeah, well they've been talking about that for a few months now.
There was regulation. What happened, they didn't do anything illegal because they were allowed to borrow a lot more than they could afford to borrow. So in that sense, it was deregulated. In that sense, it was deregulated. But
where was the SEC during all of this?
Right.
I mean, that's the
and the congressional oversight. The thing that bothers me is that congressmen on both parties were getting a lot of money from these financial institutions. And we have to, I mean, as Americans, we have to stop being apathetic. This happened in the 1980s with the savings and loans, and it's happening again. And so when are we going to learn as Americans to hold our Congress people accountable?
And quite frankly, I had not remembered the amount. What you're showing by saying
more than
200 billion, now this is 3 times that.
Exactly.
So I think that's very important to focus on. We did it only 20 years ago, 25 years ago. How many more times can we do it? And is it going to escalate 3 times fold each time? We can't afford it.
Right, and how we're not going to do it again. I mean, that's the thing. I mean, you know, and this is, and so next time it's going to be 3 trillion. I mean, when are we going to get to the point? And I think it's because as Americans we've been pretty apathetic about our political situation, and now that it's hurting our pocketbooks, we're finally reacting, but it's a little late.
It's a scramble.
Right.
They scrambled. That's basically what happened. The government had to scramble to do something to prop up the economy. And it happened, and of course the question is it going to happen again if there is no oversight?
Right.
Well, and I think it's, whether it's apathetic, it's also, as I think you said, Minerva, it's about responsibility.
Yes.
No one has the luxury of not being really responsible. And
the American people and the government.
And although it sounded absolutely beautiful to be able to take whatever you had in your home and be able to use what it was worth and get a loan against it, the reality is, for how long was that going to work?
Right.
And to keep spending beyond our means as we did it, I think perhaps the idea was okay, but...
Yeah, everybody's guilty here. The people who borrowed money, the people who wanted to buy a house that they couldn't afford, and the people who knew that those loans were going to be bad.
Okay. Well, when we come back, a very frank talk about something that is a big topic for everyone.
Very important.
Everyone. And that's healthcare reform. We'll be right back when Latina Voices return.
And welcome back. Our newsmaker is universal health care. It's one of the hot potato issues that those who represent us in Washington are facing head on, and so is everyone else.
Many believe that we need health care reform. Some politicians are eyeing universal health care or help for everyone regardless of socioeconomic status.
And with us to discuss this very controversial topic is Dr. John Zerwas, Senior Officer of the Memorial Hermann Healthcare System and a state rep. and Dr. Ana Malino, President of Physicians for a National Healthcare Program. Welcome to both of you. And I'd like to start with, we know what the problems are generally, right? I want y'all to start with a solution. Just give me your solution and then your solution, and then we'll start a deeper discussion about it. Oh, if that's possible or not.
Ladies first.
All right, I go ahead. So I represent an organization of 15,000 physicians across the United States that endorse a single-payer universal health care program. Now, what is that? That is exactly what you were talking about, which is an improved and expanded Medicare for all. Before Medicare came into being in 1964, 1965, 50% of seniors had no health insurance. And 50% of seniors also lived below the poverty level. So poverty and uninsurance was inextricably bound. Now it continues to be so to this day. And within 1 year of the implementation of Medicare, seniors were able to access health care. And now, of course, we know that if you're over 65 or over in the United States, you automatically get Medicare. Of course, you have to have been paying into Social Security and so forth. But that is the one right to universal health care that we have in the United States. And my suggestion is really not all that complicated. It's basically, instead of having Medicare from our payroll taxes, which is how we pay for most of Medicare, not all, for those over 65, let's go ahead and have Medicare for those over 65 and under 65. And we fund that through our taxes, so that in fact we guarantee health care for all, and we have everyone pay according to their ability to pay. So that's my solution. It's really pretty simple when you think about it.
Can you compare that to, and then we'll go to you, but can we compare that to another country? Is there another system just like that?
Well, very similar. For example, Canada has a single-payer system. And then people start saying, oh, but in Canada, we've got droves of Canadians coming to the United States, which is not true. In fact, we have more Americans going to Canada to get prescription drugs. But at any rate, But Canada has a single-payer system, but other countries do as well. Australia has a single-payer system. And the difference, however, is how much money we put into the system. The Canadian system, unfortunately, the medical system has been underfunded. And so they spend maybe $2,500 per person per year, whereas we spend $7,000 per person per year. And so we would be able to continue spending what we spend today without having to add another penny to our national health expenditures. And if we had a single payer system, we would save about $300 billion and would be able to cover everyone without having to spend more money.
Dr. Zerwas, as a hospital administrator, how do hospitals deal with this? You see people every day that basically have to be turned away because there is no insurance.
Well, that's a good point. In matter of fact, at least on an emergent basis, there's probably no patient that's ever turned away if they actually need care. And we have, adopted laws over a period of years such that if a person comes in and they truly need help, they're going to get that help. My sense right now as a representative, primarily, not so much as a physician, is that the state of Texas is not ready to embrace what I would call a nationalized program, or a program even like what Massachusetts has, where they have mandated basically that everybody will have insurance. Definitely different environment in Massachusetts. The number of uninsured is dramatically different than what we have in Texas. The immigration issues are dramatically different than that we have here versus in Massachusetts. The state of Texas has taken a position that we have a certain number of indigent individuals that need to be taken care of. Those will be Medicaid patients. We know that children that get on insurance are less likely to end up in our hospital emergency rooms. We have the CHIP program that covers these people up to 200% of the federal poverty level. That's about $40,000 for a family of 4. So that's pretty poor people that take advantage of this. We have the over 65, as was already stated, that are on Medicare. So we have a slice of the population out there that needs something else in order to access health insurance to provide for some of the financial means of their care. If you have a strong employer, that's where you're going to get your insurance, and that's a hangover from way back in the 50s and 60s as a way to provide insurance.
Sure.
But what we're finding...
Can we talk about that when we come back? We've got to take a quick little break.
We sure
Keep
can.
that in
Thank
mind.
you.
And we're talking healthcare reform. We'll be right back with Latina Voices.